Hello, Hanover veterans. Welcome back again to a weekly broadcast by your Veteran Service Officer, Ben Quell, broadcasting to you from the foxhole here. I wanted to go over a few topics, kind of like I've done in weeks past, to keep you up to speed on the things that are going on as it relates specifically to the veterans in our community. The first topic is not specific to veterans, but it's important for veterans to understand that it is available to them. If you happen to be getting your health care exclusively through the VA healthcare system like I am, it does not exclude you from healthcare related services that are being administered within our community. Again, I don't want you to think that you have to pigeonhole yourself into just getting your care at VA facilities. A couple weeks ago, I covered urgent care and some of the contracted organizations right here in our community, like CVS. But with the pandemic continuing, testing, you hear that a lot in the news. It's becoming really the number one focus of our government at all levels, both at the federal and the state level. And it has become apparent that we need to increase the access that our citizens within the town have. So as always, our Hanover Fire Department, our Hanover government has gotten proactive and taken charge in trying to find out how we can administer testing directly to our citizens, especially our seniors, since they are the most at risk for COVID. And I will remind you that the majority of veterans within our community, baby boomers, Vietnam veterans, are in fact seniors. So they fall within this category. We sometimes call them retirees. So we're targeting them with a program, the Hanover Fire Department is. It's called the Hanover Mobile Integrated Health Pandemic Response Plan. If you are in the home, you are 65 and over, and you feel like you are taking on these COVID-like symptoms, that you are running a temperature, you have a cough, you have shortness of breath, and you do not want to necessarily try to transport yourself or even have a family member transport you in the event you may expose a friend or a family member, you can call the non-emergency number, and paramedics, Hanover paramedics will come to your house with protective equipment, and they will administer a COVID test on you. The non-emergency number to call is 781-826-2335. That's 781-826-2335. Again, if you are a veteran who gets exclusive care at the VA healthcare system, do not let this stop you from calling this number. If you do not have private insurance that the Hanover Fire Department can bill, do not worry. They will not stick you with a bill if they have no other way of billing you, if you don't have the insurance, if you're just exclusive to VA. If the VA does not cover it, you will not be stuck with the bill. So please, if this is something you feel you're in a state of panic and you really want to get tested right away and you're one of our senior veterans, go ahead and call that number. Okay. I also want to reach out not just to veterans, but to family members and friends in our community who are in some way administering help and aid to our veterans, especially our seniors. Okay, if you are doing things like filling prescription planners, if you are driving a veteran to doctor's appointments, if you're checking in on them, if you're helping them get dressed or cook them meals, if you're in some way caring for a VA veteran, that's when I say a VA veteran, a VA patient within the VA healthcare system, then you most likely qualify as a caregiver. And if that is the case, you are eligible for the Caregiver Support Program. It's not just for the benefit of the veteran, it's the benefit of you as well. So if you're doing this, then I would like to give you a phone number to call as soon as I can find it. And I've called this number and I've spoken to them over the phone. They're very nice. It's not one of those situations where you go through a bunch of prompts and listen to 20, 30 minutes of elevator music. They come on right away and they start discussing the veteran. They verify that the veteran is current within the VA healthcare plan, or healthcare services. That means that they've been seen by the VA in the last couple of years. You talk to them about the things you're doing, and they will, right over the phone, enroll that veteran and you as the provider into the caregiver support program. And that number is 855-260-3274. There's a lot of additional things that could open up to you, the caregiver, and to the veteran. I'll give you a perfect example. Facebook, which has an app called Portal, it works much like FaceTime for all the Apple users out there. It is a way for video chats, video conferencing to go on. It's very simple to use. Anybody that can use a telephone can use this. And it's just like FaceTime, but it's called Facebook Portal. And there was about 7,400 tablets donated by Facebook. They collaborated with the American Red Cross, and any veteran and caregiver that was in this caregiver support program, they would ship one of these tablets with Facebook Portal already loaded up to these individuals so that they could communicate with each other in a safe environment. It also would open up these veterans' world so they're not so confined. It also allowed for the veteran to get services from the VA, like telehealth conferencing, right into their home and not expose them to COVID. So there's a lot of additional things that can come on, can be made available to the caregiver and the veteran by enrolling yourself in the caregiver support program. So please call that number if you feel like that's something that would interest you. Lastly, I want to talk about Chapter 115. I talked a little bit about it last week, but as this pandemic continues to last, today the governor just canceled school for the year. So we really don't have an end in sight. So as it relates to veterans, and I'm not talking about retirees, now I'm talking about the younger veterans who have lost their jobs, are in threat of losing their jobs. We really need to talk about unemployment. Not everybody is eligible for standard unemployment. When it comes to Chapter 115 for low-income veterans, it is all based on income and asset levels. And as many of you may already know, when you go into unemployment, it's about 60% of what you were making, plus there might be some additional things added on there, but it will definitely lower your income. So for a lot of working veterans who have now lost their jobs and are on unemployment, you may at this point qualify for Chapter 115 when you were working because you were making too much money, you were over income levels, okay? But now that you're on unemployment, you may very well qualify. If you do not qualify for standard unemployment, or you have exhausted your unemployment, whatever prevents you from getting on standard unemployment, there is a new type of unemployment that has been released in the state. It came on board at the end of last month. It's called the Pandemic Unemployment Assistance, okay, or PUA. It works much like the standard unemployment, but it specifically targets those individuals who do not qualify for standard unemployment. Okay, it works the same way. 60% of your salary or your pay that you were making. It also adds another $600 kicker in there that you could very well be eligible for as well. If you feel like this is something that you're qualified for, by all means, please, if you're not qualifying for unemployment, you can Google this. You can put Massachusetts PUA or Massachusetts Pandemic Unemployment, and it will take you right to the site where you will apply. Okay, the things you'll need are like Social Security number, your mailing address, your residence address, your email, a telephone number. You do need to get together pay stubs, 1099s, bank statements, okay? And you also need to get together dates of birth and Social Security numbers for any dependents, your children, your spouse, what have you. And also for direct deposit, which is what I suggest you do use if you're going to qualify for this, get your bank information, the name of your bank, the routing number, and the account number that you would like this benefit to go into. So what is this going to provide to you? It can provide to you up to 39 weeks of unemployment. And this could actually retroactive back to as early as, I think, February 8th. if that's in fact when you became unemployed and you can show evidence of becoming unemployed. So it can retroactive back to a couple months. Again, whether it's standard unemployment or pandemic unemployment, this may very well bring your income level down to a point where you can now qualify for Chapter 115. Let's talk about health insurance. What happened to your health insurance when you became unemployed? Did you keep it? Were you privately if you were self-employed, you were providing yourself health care insurance? Well, if you qualify for Chapter 115, it will alleviate that out-of-pocket cost for you. Chapter 115 recipients receive all their premiums, all their deductibles, all their co-pays back to them. It's a check that's administered through the town of Hanover, through my office. So even if you go onto what's called medical only, where you're just going to be getting your unemployment as far as income, you may find it beneficial to get onto Chapter 115 if you qualify to take care and alleviate all of those out-of-pocket health care costs for you and your family. So if you think you might qualify, go ahead and reach out to my office. To give you some ideas of what those income levels are that would qualify you, if you're getting somewhere around $2,000 as a single person, as a single veteran, $2,000 or less, you should look into Chapter 115. If you are married and both you and your wife, let's say, have lost your jobs and the only income you have coming in is unemployment, then if you're around $2,800 a month combined income with that household or less than that, you should reach out to my office to see if you qualify for Chapter 115. Now, we have a lot of services here at the Council on Aging where my office is. We also have people that can help you with other healthcare services such as Mass Health, which again, if you qualify for unemployment, it may drop your monthly income down to a level where you might also qualify for Mass Health, which has no out-of-pocket costs for you and your family. So to give you an idea, if you're a single veteran living at home and now you're on unemployment and that total income level is around $1,300 or less, in addition to qualifying for the benefits, you may qualify for Mass Health. If you are a married couple, and with now the unemployment or the pandemic unemployment, your total income level drops down to somewhere around $1,800 a month or less. Again, you may very well now qualify for Mass Health, which could really alleviate those out-of-pocket costs. So again, I hope this is helpful information to our veterans. If you have any questions, don't hesitate don't try to figure this all out, okay? If you have questions, if you have concerns, just reach out and we'll over the phone work through the minutia of figuring out whether or not you do or don't qualify for these things. Because if you do, if I think you qualify for Chapter 115, I'm going to have a whole bunch of things I need you to get together as far as paperwork as part of the application process. Don't worry, I realize we are maintaining social distancing. Department of Veteran Services is becoming really lax on how I get this information from you. It doesn't all have to come to me at once like it used to. You can kind of piecemeal it to me as you get it. So we'll work through all that. My phone number again here in the office, 781-826-5000, extension 1107. That's 781-826-5000, extension 1107. Once again, thank you for giving me the pleasure of serving as your Veteran Service Officer for the town of Hanover. Stay safe and stay well.